There is some good news tonight about Canada's vaccine deliveries. The federal government says the first shipment of the newly approved Oxford-AstraZeneca vaccine is now en route from India. 500,000 doses are expected to arrive tomorrow. Canada is also set to receive about 445,000 doses this week from Pfizer-BioNTech. That makes this the biggest week yet for vaccine deliveries to Canada. There is some conflicting advice, though, over who should be given the AstraZeneca vaccine. Late yesterday, the Federal Advisory Group on Vaccines said people 65 and older should not get the shot because of a lack of data. Clinical trials of it didn't include people over 65. Other countries, including France, followed that same advice. Now, as more real-world data emerges, the advice is changing. Crystal Goomansingh explains.
With 70% of intensive care units in France occupied by COVID-19 patients, there's a push for more vaccinations.
Ici, vous avez le vaccin AstraZeneca.
On Monday, the country's health minister reversed a previous decision, opening up the age group eligible to receive the Oxford-AstraZeneca vaccine to those over 65. The government spokesperson says there's now some scientific publication showing that this vaccine is very efficient against severe cases of COVID-19, as well as in this age group. The vaccine has been a part of the UK's arsenal since January. The British Health Secretary highlighted preliminary data showing a single dose of Oxford-AstraZeneca prevented severe infection in those over 70, with a reduction in hospitalizations of more than 80%.
These results may also help to explain why the number of COVID admissions to intensive care units among people over 80 in the UK have dropped to single figures in the last couple of weeks.
Canada's National Advisory Council on Immunizations is taking the position France previously held. More data is needed as the initial clinical trials didn't include enough older individuals. Its recommendation is for the shot to be offered to essential workers under the age of 65. But Dr. Teresa Tam says it's an evolving process.
Don't read their recommendations as sort of static. They will update as needed.
Officials, however, stress all of the shots approved are safe and effective for adults. Crystal Goomansingh, Global News, London.